Together, we can.
Together we can.
Together we can.
Together we can save lives. Please give to our research projects. Visit kidneycancercanada.ca.
Welcome. I'm so glad to see so many faces. This is our most important event every year. It's for patients, and we're here for you. So I welcome these ladies. I'm at a bit of a disadvantage, I'm going to say. I have to wear my headset because I think I'm the only non-speaking, French-speaking person on the panel today. So I'm going to take advantage. And I'd like to just put the name to the face, if I may. This is Dr. Jennifer, and please forgive me if I say Brunet. And she is our exercise specialist. And specialist, I mean specialist. We have Dr. Gillian Flower, and she is a naturopathic doctor specializing in cancer treatment. And she has some very innovative things to talk to you about. Alternate therapies. And this is what living cancer is all about. All the therapies that make us feel better on a day-to-day basis, that helps us get through the side effects, mental, physical, and we don't want to forget spiritual, because we are a whole package, and we need to address our whole being in this cancer journey. So we need to pay attention to all aspects. Moving on, I have two patients. I have, and because I'm nervous, I'm going to forget names. But we have Geneviève, and Geneviève is a patient representative. She's a paralegal, a very successful one. And you're based in Montreal?
Yeah.
Good. And she's going to share our patient perspective. And I have Hélène Veilleux. I hope I pronounced that somewhat correctly. And she is a retired policewoman. She was in charge of a special unit in the Montreal Force, is that correct? And very successful in her own right. And we have, and I'm going to forget, Louiselle Godbout, and she joined us last year, so she returned, so we didn't scare her off. So she is going to speak to you from a pharmaceutical perspective, and maybe she can answer some of your questions in regard to side effects with the drugs that you're taking, management and options as well. Maybe you're on one, you're considering another in conjunction with your doctor, but maybe you can give a different perspective. So I'll let you each take a few moments and just speak. Jennifer, do you mind starting?
So I was actually very happy to see the answers before, that I feel like I'm going to be preaching to the converted, that many people here do recognize the benefits of physical activity both during and post-treatment for cancer survivors. And so when I was looking for research areas as a trainee, I was, unfortunately, I had some individuals in my family that had been diagnosed with cancer, and they were trying to deal with a lot of the side effects. And so I've devoted much of my young career thus far to finding ways that we can promote physical activity in a way that is sustainable, that is manageable for cancer patients and survivors. We need to adapt it, and we also need to understand how best physical activity is good for particular patients. And so I've been doing that. I've been trying to raise awareness of the benefits of physical activity, and also trying to understand why it is that although many individuals, such as yourselves, do understand the benefits of physical activity, we're unfortunately not seeing individuals meet the current guidelines for physical activity that have been distributed by the Canadian Cancer Society or other organizations across Canada. So that's a little bit about me. What I can do later on is answer questions that you may have as to what types of physical activity you should be doing, how often, how frequent, what are some things that you need to think about as you're planning to start a physical activity program. So, yeah. Thank you.
So my name is Dr. Gillian Flower, and I just had the pleasure of
realizing before our talk that Jennifer and I are actually involved in centers that are working on a collaborative research project. So I think we'll be seeing a little more of each other after this panel. But I'm a naturopathic doctor, and I have the pleasure of working with the Ottawa Integrative Cancer Centre. I'm not sure if you've heard of it, but it allows me to do some of the work that Christine was mentioning in her introduction, really helping people dealing with a cancer diagnosis, with quality of life issues, helping people through treatment, and certainly working post-treatment or post their initial diagnosis anyway on strategies for optimization of health, and I work a lot with nutrition, so that's sort of my role on the panel today, is to talk about food and talk about good food to eat, talk about some of the myths as well that exist, that are out there about foods you must avoid at all costs, and really the approach that I hope that you leave with is a balanced approach to your diet, but one focusing on some key foods that are important to include. So I also welcome your questions and look forward to our discussion today. Thank you.
Hi, my name is Geneviève. My experience is I had kidney cancer. I was diagnosed in 2014. I realized today that there is a lot of options, and for me, I was not offered much options. I was only offered to remove completely the kidney because it was in the middle and it was growing. Unfortunately for me, my path or my journey after wasn't that easy. I had some consequences on my health after the surgery, and since 2014 it's been on and off, not so fun, starting with immediately post-surgery acute pancreatitis, and then it went on. It wasn't very easy for that, and because it was a neurologist and it wasn't a team, my experience was it was very difficult to get information, to get support, and to have information. That is still very challenging, and my specialist wasn't very talkative. So I needed my family doctor to be very much involved with me. Thank God I had, my uncle is a doctor, so thank God he was by my side at the hospital when that happened. And one of my best friends is a pharmacist, so I got lucky. But I had a very different journey than most people, maybe with something that should be very simple, just as removing a kidney. So that's my experience that I've had.
Thanks, you. Hélène?
Je vais y aller en français.
Yeah. Oui?
So I will speak French. I was diagnosed at the end of December 2008. So that will soon be more than 8 years ago. And I had a period of 4 years where there was no recurrence. The recurrence came 4 years later. And since then, I've been taking Sutent 3 times, and I've also had 3 other surgeries. And I have been taking Sutent for 1 year now. So I can very easily talk to you about the side effects. Hello, I'm Louiselle Godbout. I'm a pharmacist at the Cancer Clinic in Ottawa. I'm here very much to help you to alleviate your side effects. There seems to be an echo. It's especially to help you to alleviate side effects, to see how the pharmacist can help you, to make sure that there's no interactions with other drugs, to make sure that you can get the full benefit of all your treatments and that you can continue on your treatment as long as possible. Your treatments are there to help you in your quality of life. We certainly don't want to worsen that. And we're here to answer your questions. Thank you.
Before we get started, do you have a question from the audience for a particular panelist? This gentleman in the middle.
My question is for Madame Godbout.
Mm-hmm.
It's I
have a question for Madame
I have
Godbout.
always acid reflux, and I take pantoprazole, but I heard that there is a interaction between Sutent and pantoprazole. maybe you can help me with that. Is it right information or not?
There are a lot of drugs that can interact with your PPIs, or protein pump inhibitors. It's usually because these drugs are absorbed in an acidic medium, and if you increase your pH of your stomach, the absorption is less. We try to recommend that if you can switch to an H2 antagonist, such as Zantac, cimetidine, any of the others, that the duration of the pH effect of these drugs is less. So if you can take an antacid or an H2 blocker in the evening and take your Sutent in the morning, or vice versa, that you leave at least 10 hours between the two, you probably will get major absorption from your sunitinib. Il n'y a pas de différence si vous prenez
Answer, there's no difference if you take one or the other in the morning, but you should take them 10 hours apart, and it doesn't matter which you take in the morning and which in the evening.
Another question?
This is for Hélène. Your recurrence was 2000, and 4 years later. I wondered where your recurrence was.
Well, the first recurrence was in the diaphragm and on the psoas, just on the same side that was the renal tumor was.
Okay. Next question. Well, I have a couple of questions. Oh, I'm sorry. Somebody at the back. Dr. Riom.
My question's for Dr. Brunet about oncology exercise. So Sutent has a lot of issues with hand-foot syndrome, and makes it difficult sometimes for people to do exercise, or their traditional exercise. A lot of people are runners and things like that. What kind of alternative should I suggest to my patients? What's your go-to for someone who can't handle impact, kind of?
So I actually would like to demystify what exercise is. I have much more of a lifestyle perspective on it, and that physical activity is any movement that body can do. And so any patients I work with, we really try to get them to understand that exercise doesn't have to be that structured, going to the gym, that routine, or that aerobic activity that we're used to. So sometimes it's incorporating resistance training, which does have bone strengthening benefits, that does have those psychosocial benefits. In coming to work with adolescents and young adults, in my experience, we do have to deal with some individuals who've had amputations and those sorts of things. So it's really pushed us to look at alternative forms of physical activity. And most recently, I've started to look at the benefits of yoga therapy, which is just getting your body moving, getting to become more mindful of what your body can do. We've done many, many different adaptations with patients in doing group-based exercises where individuals who had issues with balance, or we would have them do floor exercises, we would have them do exercises with balls. So it's not all about running, it's not all about jogging or those strenuous aerobic activities. It's really is finding something that your body can do, but also that people come to enjoy in a setting that they enjoy. And I think that's what I really, really strive to do. So sometimes it's just walking, bicycling on a stationary bicycle if they have balance issues, or if they, we have a lot of individuals who deal with cancer-related fatigue and persistent levels of fatigue, and so we also try to schedule it at a time that they feel that they're at their best physically, for that reason, yeah.
Would this be on a daily basis, do you recommend, or weekly? Like, what kind of a routine, modified routine, are you suggesting?
So with Cancer Care Ontario, we released physical activity guidelines for any cancer patient and survivor. And in those guidelines, it recommends to spread out physical activity. Because sometimes we'll ask individuals and they say, yeah, I do 150 minutes of activity, but they'll do 2 really long sessions a week prior to that. Instead, we recommend that individuals accumulate a little bit of physical activity every day. And if individuals can't do a 30-minute bout because it's too much, we encourage them to do it in bouts of 10 minutes. So say you can do a 10-minute walk in the morning, 10-minute walk at lunch, and then late afternoon another 10-minute walk. So the idea is really every day to accumulate a little more.
Okay.
The other recommendation that we do is just to try to break up sitting time as much as possible, and that's something every day. So there should be no long resting bouts. Obviously when you're sleeping it's a different situation, but you know, if you've been sitting for 30 minutes to an hour, just get up for a few minutes, walk around, sit back down.
Shuffle around the dining room table a couple of times just to get things moving, the blood going.
Yes, household chores are considered physical activity. Many individuals, when we ask them, how much physical activity do you do? They actually report very little. But then after that, when we start looking at what their week looks like, they've passed the vacuum either because they're a neat freak and they've done it several days, they've done wash, so they've had to go up and down the stairs with some laundry and those sorts of things. Those are physical activity. Gardening is physical activity. And so when I say to pick something that's enjoyable, if gardening is something that you do with your partner outside, fresh air, and it's enjoyable, that is physical activity.
Thank you. We have questions from Stephen, and I'm going to ask you one quick question. Is there somewhere, for example, my mom, when she was incapacitated, she watched a particular show in the States that helped with the armchair exercise. Are you aware of a show or something for people that are in rural areas or not available to access supportive activity? Is there something that you're aware of that they can maybe take advantage of?
The unfortunate answer is no, and what leads me to be rather confident in that is we received a grant from the Canadian Breast Cancer Foundation to do a scan across Canada to see what resources are there for the promotion of physical activity, both in urban and rural settings. And unfortunately, there's not infrastructure in place. There's no satellite programs or anything like that. So obviously our next mandate is to make sure that individuals who are in these more remote locations, whether it be Northern Ontario or other areas, that they do have these same access and that they're personalized and adapted to their unique situation.
Great answer. Thank you. Stephen.
I have a couple of questions. One for Louiselle. The interactions of food with drugs such as Sutin, for instance. I know that we've been warned not to take grapefruit. Last night we had a bit of a question of whether you could have an orange. Would you like to talk a little bit about that?
Yes. Because of the metabolism of a lot of these drugs, there's a certain enzyme that metabolizes that, and that enzyme is also found in grapefruit. It is not found in oranges. It is also found in pomelos and Seville oranges. So the Seville oranges are the oranges that most Brits will use to make marmalade. Sometimes in North America, we don't use the Seville oranges to make our marmalades. So it's important for you to look at, if you're a marmalade person, to look at what oranges are in the marmalade. And again, we have not been able to quantify how much interferes. So if you have a tablespoon of marmalade on your toast in the morning, is that enough to interfere with the metabolism or not? The other thing that could probably help is, again, separating the time that you take these stuff, because it's the inhibitors of these enzymes are grapefruit and Seville oranges and pomelos. So you have that problem there. But nobody has ever really quantified. So we always say not to do it. Most people say, well, I don't like grapefruit, so it's not a problem. And that's also a common interaction with a lot of other drugs. So I find that a lot of the patients I talk to have stopped using grapefruit in a long time. So it's not a problem. The other emerging ones are pomegranate and starfruit. that seem to have also that same enzyme that increases the metabolism, therefore decreases your blood levels of sunitinib. So you may have that interaction. You may not be able to get the full benefit of your drug.
The other thing I would like to ask is, and I found this a challenge when I first went on Sutent a number of years ago, is that some of the clinicians that may not be familiar with the drug were prescribing drugs that really had interactions with that. And some would argue with you. For instance, I knew that I was not to take any cold medication when I was on Sutent, for instance. And it is a challenge. How would you recommend, one, that you check for interactions, and the second one is approaching a clinician or maybe even the pharmacist where you're getting a prescription to ensure that you're not putting yourself at risk?
Yeah. One of the big things is that you maintain relationship with one pharmacy, so that one pharmacy knows all of your drugs, so that they can do a screen of drug interactions if there are any. Cough and cold medicines is tricky because cough and cold medicines, there's a plethora of them. Not everything has the same ingredient. The cough and cold product that you should probably avoid is a decongestant, which acts on your blood pressure, which acts on your blood vessels, which all of these agents that usually are used to treat kidney cancer are vascular agents, except for the immune oncology ones, in which those interactions are not as significant. It's with the oral therapies that we talk about. So it's important for you to develop a relationship with your pharmacist, and then the pharmacist can argue with the physician or not, whether the interaction is significant, and help you along with that one.
And
I was just going to say, along with that, cough and cold remedies that you were speaking of, Stephen, often people will take, Tylenol or Advil. Another popular one is Aleve, which can have, I understand, quite an effect on the kidneys. Can you give us a little bit of information on what we should be staying away from?
Well, I would say that the non-steroidal anti-inflammatories, your ibuprofen, your Advil, your Aleve, which is your naproxen, if you take it on a very sparse basis and not continuously, it probably does not make much difference. The problem is these agents can also increase your blood pressure, which again is one of the common side effects of these oral agents. So yes, you have to be cautious. The other concern is that some patients who are on actual chemotherapy, and we talk about these agents, the oral agents, as targeted agents and not chemotherapy, is that they will affect your blood cells, your platelets, which affects coagulation, which these Aleve and ibuprofen can also affect. So that's a different interaction than the interaction that you have with your sunitinib or your oral agents. So I think on a very sparse basis, if you have an achy joint and you want to use one, it's not that significant, but if you're going to start using them regularly all the time, it really is something that you should probably stay away from.
I have two questions for Dr. Flower, and I'll hand the mic back. Gillian, a couple things. One, naturopathic medicine isn't embraced universally across what I would call the Western medical system. Some doctors are more open to it, others are not. Could you talk a little bit about that and how people would come to you? And the second thing is, are there alternatives when you get into these situations where, like I have right now, probably the worst cold I've ever had in my life, that you can use anything naturopathic to reduce the symptoms of a cold without conflicting with drugs such as Sutent?
Okay, well, maybe I'll start by answering your second question first. And this is where the work that I do is really made so much easier when we can work within a model of integration. So I'm delighted to meet Louiselle today, and hopefully we can collaborate in the future, because certainly agents that are natural that doesn't mean that they're without their side effects or without their potential for interaction. One of a natural agent, for example, that has a similar interaction to grapefruit on the metabolism of many drugs is St. John's wort that many people will take for depression. So I guess this is just to highlight that you do need to be careful, certainly, about potential drug interactions. So I'd probably suggest a similar strategy as Louiselle did of spacing your medication, being aware, hopefully with consultation, about the half-life of the medication that you're taking, which is the amount of time it takes for the medication to drop to half of its dose in your blood. So if you're spacing things out adequately, then you reduce some risk of that interaction. I guess in terms of things that could help a cold, there are many different symptomatic strategies, and things like steam inhalations might be helpful, or rest fluids. The good advice that our grandmothers gave us certainly are things that I would come back to. There are some immune supporting agents as well if you're getting chronic infections. Good old vitamin C sometimes is helpful, but again, I would want to check on interactions, knowing that it can change acidity in the stomach and things like that. So I would say yes, there are definitely options, maybe not alternatives, but options, and things that can be supportive of your symptoms and of recovery from something like an upper respiratory tract infection. I'm really glad you raised the question of the role of naturopathic medicine in all of this, because as a center, it really is our mission to foster integration. I'm delighted to be on a panel such as this and to have the opportunity to speak to everybody about the type of work that we do, because it really seems in my mind to serve the patient best if we can all talk, if we can all be in communication about the different strategies that we all use. Naturopathic medicine is a regulated health profession, and we have been for almost 100 years now. We are licensed. If we do something you don't agree with, we have a board you can complain to, but really we are a legitimate, recognized profession within Ontario. And you mentioned, in terms of Western medicine, there are certainly in other countries, maybe more of an acceptance of naturopathic medicine, but I'd say we're making some progress, which is good.
I agree.
But bit by bit, for sure. But I guess what we do to really try to foster this integration, we do it within our centers. So we have a number of different healthcare providers, naturopathic doctors like myself, acupuncturists, massage therapists, counselors. We have registered dietitians, we have nurses, we have medical doctors, and we all work internally as a team. But then we really are reaching out to the greater medical community to get the information out about what we do, and to really create relationships with other healthcare providers to really be part of the circle of care for our patients.
I have a question. How do we get in touch with those centers? Do we need to be referred by our doctor? Can we approach you on an individual basis?
Our center is self-referral, so you don't need to be referred by any particular practitioner. So you can just come into our center, call. We have information on our website, for example.
Okay.
But unfortunately, we are one of very few centers in Canada. We are pretty much one of a kind as far as I know. There is another fantastic center called Inspire Health in British Columbia. They don't quite have the same approach as we do, but a really amazing center. But unfortunately, the centers that provide this type of care are few and far between. I also wanted to come back to something you mentioned at the beginning, Christine, which was the idea of alternative care and just differentiating that from complementary care. And I think what we try to offer to most of our patients is a complementary approach. So the majority of people that we see are receiving care from outside of our center, from their oncologist, through their family doctor, however that may be. And we really encourage that, and we really want to work alongside the care that our patients are already receiving. There isn't a lot of evidence for things that can be standalone alternatives to the conventional care options that are out there. So I guess I wanted to make that clear.
That's kind of what I wanted to touch on. Yes, of course, Geneviève.
I just want to mention, you said we don't need a referral from a practitioner to go to your clinic or to, but as a patient, I would say you still need to talk to your doctor about it, because on a financial side, you might need a referral to go to your insurance after, and this is just, money-wise talk, because we do have a lot of expenses sometimes when we're sick, and it's always better to have your practitioner involved in everything and to have reimbursement if you can, or at least they know what you're doing on a separate side, which is, for me, I think, very important. Just wanted to add that.
Thank you. Yes, it is very important.
Yeah, thank you for adding that, because some massage, for example, is not covered by many insurance companies unless you have a referral. Physiotherapy, same thing. So certainly that would be a great suggestion. And also just to have, again, your care team aware of all of the options that you're considering. I think that makes the most sense for everybody and allows everybody to be best positioned to provide the best care possible.
Andrew?
So our impromptu survey here said almost 50% of the people changed their diet. Is there any evidence that any specific diet changes help? Like, what is the real evidence out there on that? I know people that have become vegetarians once they were diagnosed, and there's different people, and maybe our two patients might also tell us what they did.
Yeah, and I would love to hear from the patients to find out what your experience was if you wish to share, but I'm glad you brought that up, because I think there is, unfortunately, a lot of myth out there and a lot of misconception. And when you're dealing with something like a prescription like Sutent, for example, which you could be on for a year, 2 years, 5 years at a time, I mean, it's something that is, you don't want to be making radical changes that are not sustainable. So I think that's the most important piece underlying the recommendations that I make to patients, is how can you sustain the recommendations that we're looking at. Review of the literature that I did recently showed that fruits and vegetables and high fruit and vegetable content seem to be the most protective in kidney cancers. So that really is my take-home message for everybody. I mean, certainly if you have limitations in your diet because of renal failure or because of other diagnoses, you need to take this advice with that in mind. But increasing your fruit and vegetable intake is the best advice that I can give. And I know that this is this is not new news. This is something you've probably heard before. But this really is where the best evidence lies. Certainly there's some evidence that there's a role of pesticides in kidney cancer. Does that mean that going organic is going to have an impact on recurrence? We don't have the answer to that. But I mean, if that's a choice that people make to feel they have a bit more control over what they're eating, or that informs better food choices, then I totally support that. I guess I just like to make sure that whatever diet people are following is not causing undue stress or undue harm in terms of the food choices they're making. But the foods that I would highlight would be fruits and vegetables. Actually, vegetables and fruits is how I prefer to position that phrase. It's pretty easy to eat fruits, but eating your vegetables can be tougher. And certainly if you're dealing with taste changes from treatment, getting those greens in can be tough. But trying to incorporate fruits and vegetables into everything that you eat is sort of my strategy. In a nutshell, is trying to get you to eat kale chips and make sure that you're having some spinach in your smoothie, and trying to sneak it into different foods if that is a problem.
Can I add a comment to this? Most of you who are undergoing treatment will have some aversion to a food or something, or a food may make your side effects worse. I guess the normal thing is to avoid it, and I would support that you avoid those foods, but try to get at least some fruits and vegetables in. If broccoli is not the one that you like and it makes your diarrhea worse, well, please stay away from it. And don't force yourself to eat something that you can't. Just.
I'd like to speak to our patients for a moment. And did you make I made some radical changes when I was first diagnosed. Did you find that you made radical lifestyle changes when you were first diagnosed?
Je vais répondre en français. Je vais être plus à l'aise.
I believe that we were well fed at home. Of course, we ate more fruits and more vegetables, but under Sutent, I drank a lot of smoothies. It was good because it was cold. And sometimes I ate a lot of milkshakes in the summer, as well as ice cream, because it is very soothing. Okay, radical change was that I decided to cut red meat. I have a hard time trying to eat meat, so I decided to eliminate meat, and I include a lot more fruits as well as vegetables.
Well, me, I was asked to be to remove the most salt, to free diet, and no fast food, nothing, because I had issues with this type of digestion, and so fast food was out. It wasn't very big, but now I think twice before when I'm on the road or something, I try to make a better choice. And also we cut on the red meat as well at home.
Mm-hmm. Thank you. Is there anything that you'd like to add to the patients that have come here that are living with it day to day? Is there anything important that you've learned today or learned in your journey that you'd like to share? Now, Geneviève, you touched on that you were not given all the options when you started with your cancer. Obviously, you've learned some other options today. So it's difficult sometimes when you come to the patient event and you see all these other options and changes that are available to you. Do you have any recommendations for patients out there?
Well, first, I have to say it goes really fast. When we have this, when they find the mass and then they meet you, things go really, really fast. For me, I was speaking with Nicole, that is not here today, and she was urging me to go to a second opinion because there were things that for her were a little bit odd with my case, and she wanted me to go see, what's the name of your specialist? Dr. Tanguay in Montreal. In my situation, I have to say, I was so scared to offend my urologist because he was there and because he saw me so fast and because I was so scared because he was really into like, this is very important, you gotta get your surgery now, we gotta pull it out, blah, 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 blah. And we were still in shock. I was so scared to offend him or to take longer procedure, and this was in Quebec. It's a big talk. We can't see a doctor. It's so difficult. So I was like, oh my God, if I go see that doctor, he doesn't think my case is important. It's gonna take longer. And my case, what happened is it dropped between two chairs because I was first, they saw the mass a few months before, my doctor got sick, nothing happened, and when they did other tests a few months after, they noticed it had growth. So I was so scared that I went right with what was offered to me. So what was the option for me, according to my doctor, was the radical nephrectomy. So that's what I did. And never once did he really talk to me about other options because he started drawing and showing me where my tumor was and stuff. And then he said, well, just like I wouldn't go with radical, and just go with the full. That's pretty much how he told me. So, you know, when you're first meeting with the doctor, we don't even know what to say. And me, in one day, I had like, do you have a will? You need a surgery. It's very important. There's consequences, and you might get. He told me things that he might have problems with when he was going to do the surgery. So we got off in the car. I already almost had a date for my surgery. I was like, oh my God. So no, I didn't go with a second opinion. But now, with time back, looking back, I would suggest it also maybe to see others. And now I'm with the same doctor. By the way, he's a great doctor. just want to say maybe he was not the best talkative doctor that I had. But maybe it's important to take a step back and think maybe a second opinion is still good too.
Thank you so much for sharing that. And that's a common thread. I think we may have all had that same, when they give you your diagnosis and you get that aha moment, like, and you feel sick and you're going to pass out and everything else, and all these decisions that you have to make so quickly. It is okay. It is a very serious situation, but it is okay to just to step back for 1 minute, take a couple of deep breaths, and do a little planning or questioning before you jump in both feet. So I appreciate so much that you shared that with us. And do you want to share anything advice for patients out there? Now, you're on a different kind of treatment, I believe, and is there anything you'd like to share with us that we might learn something from?
Je vous dirais depuis le diagnostic.
Since I was diagnosed 8 years ago, I'm telling you that it is easy to have a good lifestyle, and I keep on doing activities. When I was diagnosed, we were supposed to go on holidays 6 months later, and my spouse said, no, we won't cancel anything. The doctor said that I would be in good shape. So I kept on working. I kept on doing what I did. I was operated in July, and we were in Vancouver in July. I was able to swim after 6 months, and I told everyone, listen, I can swim very fast, although I have only one kidney. So we were able to travel, to take advantage of the family. Now I am retired, but I am still hyperactive. I am a full-time hockey mom. My son goes to the arena 3-4 times a week, and I'm always there to cheer him up. Of course, yoga, yes. Massages, yes. When I was diagnosed, I wanted to prepare my retirement, so I took a course, and I work with sportsmen. I give them massages, and after this 2-week cycle, I always have a gift. I have a co-worker, and when my treatment is done, I am being given a huge massage that is about an hour and a half long. Yes, I take long walks and I take fresh air. I believe that although we have secondary effects,
for sharing, and you give me hope.
We can
because,
be happy.
You know, everything that you've been through, and you're doing so well after 8 years. I look at you. I'm sure you have terrible days. But, I can look at you and think, you know what, she's doing it, it's possible for me too. So these kind of stories are so hopeful for many of us. So I thank you so much for sharing. And I thank all of you. I think that Stephen is trying, we have one quick question. Okay.
Oui, j'avais une question.
Yes, one question. I love taking a glass of wine, but I couldn't have wine, so I am asking you the question once again. What's your opinion? Are we allowed to drink wine while being treated, during the treatment? I support the quality of life, so if you want to drink a glass of wine, go ahead. Can I answer? As a patient? Well, it depends of my cycle. After the second week, I don't touch wine, but at the beginning of the week, it's okay. But I can't drink red wine. I can drink only rosé and white wine. Everything has to be taken in moderation.
I think
but
that's
you
great
can have
news
wine.
for the audience. And
Je crois.
Can we do one more quick question? Very quick question, because we're trying to keep time. Go ahead.
Je voulais juste poser la question pour...
I wanted to ask you a question for loss of appetite. Do you have any suggestions? Is it a side effect? It depends on the case, but I think you should maybe eat small meals instead of having a huge or a big meal. In doing so, you will be able to have a few bites at a time. Just eat little. Et c'est peut-être un objectif encourageant.
You are getting some food in. C'est très important de manger.
It is very important to eat non-saturated fats, for example, avocados, fish, oils, because the level of calorie is the highest. So it will be much better for you if you eat small meals. For those who lack appetite, I believe that soups are good. Things that are easily digested really help. Smoothies as well, if you can add oils or proteins, it is very important and it can give you a lot of benefits.
Thank you. And if you have questions, I think
Merci.
our panelists will be here. Please feel free to approach them. I'm sure they'll answer your questions. And I want to say thank you so much to these ladies for sharing the platform with me. It is most appreciated, and I think they gave you very valuable information.